This is lab 20 on the dog specimen. So today we're moving into the pelvic limb and doing some arteries and veins. So you will need to reflect on the right side, the skin from the hind limb. So you can take it off, and it says to encircle the knee and then later you're skinning down, but I just do the whole thing at once. So I just take all the skin all the way down and then reflect it on the right side. Okay, then we'll turn the dog just a little bit here to start where we left off before. So on the previous lab, we were in here and did the internal iliac artery, which is right here, and we followed the internal pudendal, which was this branch here. So now today, we're going to follow the other branch, the much bigger branch right here, that is the caudal gluteal artery. So we're going to follow that, and here you can see one branch coming off right here, and this is the iliolumbar artery. And then if we pull it away down here, you'll see another branch coming off right here, and that will be the craniogluteal artery. And then this continues down this way, and that is just the continuation of caudal gluteal there. So I'm going to flip the dog to the lateral side, and we'll see where those are coming out. So here on the lateral side, you're going to make some cuts into your gluteal muscles. So you're going to reflect superficial gluteal from the insertion here, and just cut it and reflect it. And you're also going to reflect middle gluteal, and you can cut that at its origin and reflect it towards the insertion here. And then the iliolumbar is one that's really difficult to see, and it's deep down here. If I can pull it out here, it's these little tiny branches you see coming out right here. So iliolumbar is right here. Really small little branches are coming out right here. So iliolumbar might be difficult to find, but if you can, it's just on that cranial edge of those gluteals there. Okay. Then after you reflect your gluteal muscles, much easier one to find will be the craniogluteal artery coming out. So this nice big one right here is craniogluteal artery coming and wrapping around here. And then you'll continue to follow. So craniogluteal is this one, and this is that continuation of caudal gluteal that continues out this way. So then you're cutting your biceps femoris and reflecting that, and kind of seeing how that just wraps around here in the rump. So right there, caudal gluteal coming down. Alright, then we'll flip the dog back over again. And now we're going to focus on the external iliac. So here again for orientation was the internal iliac on the right side. So now we're moving on to this external iliac here. So external iliac will be inside the abdomen. Once you go through that vascular lacuna and out into the hind limb, that then is the femoral artery here. But here we have external iliac. And external iliac gives off a deep femoral, which will be this branch right here. And deep femoral then gives off this branch, which is the pudendo-epigastric trunk. So if you see, it has two branches, but it's coming off of this little tiny trunk. So pudendo-epigastric trunk coming from deep femoral. And then you have that branching into two branches we've seen before already. So this one is the caudal epigastric, running along the deep face of rectus abdominis. And then here, this one is going to pop through and be that external pudendal that we found previously here. So this is external pudendal here, caudal epigastric here, both coming off of this little pudendo-epigastric trunk. Okay, so then deep femoral has a name change. So after pudendo-epigastric trunk, that then becomes the medial circumflex femoral artery. So here is medial circumflex femoral artery. And that you're going to follow. That goes out through that vascular lacuna as well, into the hind limb. And here you can see I've cut pectineus right here to follow that. And then it has two branches, so you just kind of have to dig for them and kind of dig through adductor and move pectineus out of the way. So here's your branching. You have a deep branch right here of that medial circumflex femoral. Then you have a transverse branch right here, kind of diving into adductor here and following along. So transverse branch, deep branch, coming off of medial circumflex femoral. All right, then back to that external iliac right here. And as that goes through the abdominal wall out into the hind limb, then we go to that name change. So this is femoral artery here. So femoral, and then femoral will give off several branches that we're going to identify. The first one here kind of goes under sartorius and is the superficial circumflex iliac artery right here, somewhat small. And then if you lift up on femoral, you'll see a bigger branch going this direction, and that will be your lateral circumflex femoral artery. So that's this bigger piece here. Okay, then we'll follow femoral artery, continue down the limb, and you're looking for this proximal caudal femoral artery, and then you continue following femoral, and we look for the saphenous artery. So right here is saphenous artery, and that will follow right alongside your medial saphenous vein, which is right here. And so saphenous artery then branches and has a cranial branch right here, loses its injection here in my specimen, and a caudal branch right here. So that's saphenous artery. Then you're looking for a descending genicular artery. So genicular refers to knee, and so that's going down toward the stifle, the knee joint. Descending genicular. Then you have a middle caudal femoral right here, coming off just distal to those two other branches that we just identified. So middle caudal femoral. Then femoral continues, and you're just going to cut the muscles that are in your way and just kind of peel them apart and move them out of the way. And as you follow this down, you have to dig kind of deep, and the final branch that we're looking for down here is the distal caudal femoral, which is this big guy right here. So distal caudal femoral, and then we have another name change. So femoral then continues as the popliteal artery here. So after that distal caudal femoral, this then is popliteal. And popliteal will dive deep, going through to the other side. And so if you lift up your cranial tibial muscle, here again we kind of lose some of our injection, but I'll pull it out of this hole here. So this is the cranial tibial artery at this point. So once it pops through, it's cranial tibial artery. Okay, so that's it for arteries. And then we just have, so we did point out this medial saphenous vein right here, running alongside the artery. So medial saphenous. And then on the dog we have this lateral saphenous, which is nicely injected on this specimen. So lateral saphenous vein right here. And this right here is the cranial branch of that. So used often as a venipuncture site in canines. So this lateral saphenous right here. And the cranial branch, this part right here. And that should be it for Lab 20.